Hello and welcome to day 5 of the Housing Equals Justice CCH Annual Training Institute and Conference. My name is Madeline Ravish and I am here from Connecticut Coalition to End Homelessness to welcome all of you to today's panel on the changing landscape of homeless outreach during COVID-19. So thank you so much for joining us today. I see people coming into the room right now, so to speak. So we're delighted that you joined us for what should be a fabulous conversation. A little bit about the Housing Equals Justice Conference. This is a conference that we hold every year, normally in Hartford at the Convention Center, but this year we are holding it virtually and are thrilled to have over 1,000 people coming together to explore topics like racial justice, criminal justice, and economic justice as they relate to homelessness, and to look at issues like COVID and its implications for homelessness. So thank you all to those who joined us from throughout the state and even throughout the country. And if you are enjoying this conference, please help us tell the world that housing equals justice. We do have hashtags ATI 2020, Housing Equals Justice, and End Homelessness. And we are on Facebook, Twitter, and Instagram. So please help spread the word. We do have a few more sessions today and really want everybody to take advantage. And of course, a special thank you to our sponsors. We are grateful to Bank of America and Zillow, our presenting sponsors, who've made it possible for us to offer this conference to you free of charge. And to our workshop sponsor, Liberty Community Services, which has made it possible for us to bring you this session today. So thank you to our sponsors. And if you haven't checked out the Housing Equals Justice store, please do. We've got wonderful t-shirts. I'm wearing one right now, mugs and face masks that you can purchase with proceeds going to the Housing Equal Justice campaign to end homelessness. So please check out the store at the ATI website. And so now I'm really pleased to turn the stage over to Michele Conderino, one of our board members from Open Doors, who will be moderating the session and introducing our wonderful panelists for today. So Michele, please join us on the
Thank you so much, Madeline. I'm so incredibly grateful to be here and to moderate this session today. We have some wonderful panelists with us today, and I'm actually going to ask them to introduce themselves. And I'm going to start with Marianne. In your picture? Oh, there you are.
Hello.
Hi.
Hi. Yes, I've been doing outreach for about 10 years, and the last 5 years I've been working with Brian's Angels and St. Vincent de Paul, and I do outreach in the Bristol area right now, and I've done New Britain also.
Lovely, thank you. And David?
Good morning, everyone. I'm David Horst. I'm an outreach worker at the New London Homeless Hospitality Center, where I've worked for a bit more than a year. I've been doing outreach work since February, primarily in New London and Groton.
Lovely. And Sam?
Hi, I'm Samm Williams. I also work with Open Doors. I do outreach in the lower Fairfield area, and I've been at Open Doors for a while. I went from a supervisor to doing outreach work.
Lovely. And Sharice?
Good morning. I'm Sharice. I'm with Catholic Charities, their homeless outreach team. I've been in the outreach position for going on 7 years now.
7 years.
Yeah.
So, you know, as Sam said, so I'm the executive director of Open Doors. I actually started my career in homeless services as an outreach worker and supervised, and I actually used to oversee Sharice's work. So it's sort of a nice coming home to be working together again, and our other panelists as well. And I have to give Sam a little shout out for rocking her Housing Equals Justice sweatshirt. So thank you for that. You know, outreach has always been a challenging job. It has always required a little bit extra because, you know, we're always out engaging with people and trying to connect people who have not been connected to services and to the idea of housing, medical services, clinical. COVID has certainly added an interesting new aspect to the work. And so we wanted to talk a little bit about that today and about how you conduct outreach during a pandemic and why it's so critically important, you know, as where we are today. So I'm going to start the first question for those of you who had been working previous to COVID. So how has the work changed since the pandemic started in March? And Sharice, I'm going to let you jump off on that one.
Well, pre-COVID, you know, we had client contact. So I was actually in the field every single day, going out to local shelters, the soup kitchen, really face-to-face with clients and meeting their needs and face-to-face. However, since COVID, it's been quite difficult in the beginning, but I was able to navigate a way that we can still do outreach and, you know, in the situation we're in. In the beginning, it was mostly phone calls and utilizing other agencies who are actually out there to communicate with me back and forth regarding the wellness of a client, what their needs are and things like that. And a lot of it is a lot of computer work, Zoom calls. So it's a big, huge change from what my normal day would normally be like pre-COVID. But now we're getting back into the office and getting back to face-to-face. So we've developed plans on how to do that safely. Once a week, I'm out there driving through my normal spots, making sure like they're safe, they have masks, and that's how we do our communications, a lot through car. We meet up at certain places where we know it's going to be open so that everybody's safe. So that's basically how we get that outreach done now that we're starting to get back into what we call somewhat normal.
Yeah, right. Creating our own
normal, exactly.
Right.
But yeah, that's it.
Marianne?
Yeah, a lot of what Sharice said. I mean, I still did the outreach out and about and everywhere, but it was hard. Like I got used to meeting people at their Dunkin' Donuts or McDonald's. They were charging their phones, and I couldn't find people, you know, like that. And also, I would be able to give rides to people here and there. I couldn't do that anymore, so I had to. They could take buses because it was free. But if it was like one time somebody needed to go to detox, and I actually Ubered them.
Yeah.
I have some people from my church that they give me discretionary funds to help, you know, with the homeless people, and I'm able to do, you know, Uber and things like that. And Facebook. I use Facebook a lot. Anybody that friends me out in the community, I accept, and I do a lot of communication with them through Messenger and Facebook.
It's interesting, right, how technology plays a role in outreach. And I think we've seen that evolve over the years as, you know, as technology has evolved, as the access to phones and then smartphones has evolved. I think it's really changed the way outreach can connect with people in such a more positive way. You know, I think we always used to laugh, right, Sharice? It's like everybody's got a Facebook page. So,
right. Oh yeah,
everybody.
Right.
Yeah.
You know, and I think about sort of how this pandemic has gone. I think sometimes we forget the days that have passed, but it really, you know, sort of hit us very strongly, right, in late March, early April, May, maybe part of June, and things sort of, you know, at least here we were like changing policies, right, as we went, and particularly around the areas of safety as we gained more information. Someone, anybody wants to share how they really thought about safety with outreach, like how to conduct outreach in a really safe manner?
I think it's really about, your boundaries and safety. So if like for my agency, what we've begun to do is, since we had to limit people that come to our office, my supervisor and I came up with a plan of creating cards with needs and services that someone might need. And then as I'm outreaching, we drop them off at certain places where we normally see that people would meet. And they would be able to, fill out that card, their name, and let us know what they need, and then drop it off at a drop box at our office. And then we can arrange a way of connecting out in the community together to, to get those things done. And providing safety things, like if they don't have masks, we can provide that for them, and just helping to all of us be safe and everybody getting their needs met at the same time.
Right. Can I ask you a little bit about that? So what is on that card?
So, oh man, I wish I brought it with me. It's in my car. So basically it says our agency has my name as the community worker. It asks for their name. We have some key services, whether it be housing, benefits, treatment, mental health, substance, anything along those lines, benefits, and they would simply check off what it is that they need. They have a space to put their contact information or where I could find them, and that's it. And they'll bring that, put it at a drop box at our office, and that's how we'll connect.
That's very interesting.
I like that idea a lot.
Yeah. Does anybody else, thoughts about safety? And
for myself, I did all the usual precautions. I found, even at the height of the pandemic, I wasn't reluctant to go to the sites, but I did all the necessary protective things for myself, but also to model to others. My first move with folks at our two encampments, one in Waterford and one in Groton, is to provide accurate information. Most folks have phones, pretty well informed, but as we all know, the information has been rather mixed. So I did some leafleting. I took leaflets, I laminated them and stapled them to trees. And some of the information was particular to folks living unsheltered about not sharing cigarettes, not sharing needles and things like that, and keeping social distancing and so forth. And I provided, I put some waterproof boxes on trees with masks and some supplies, which always went very quickly. The other thing I found too, I mean, this is always important, of course, but I really was attentive to people and their phones. Most of our folks have phones. They are an absolute lifeline, of course. But if people needed help with minutes or they needed a replacement, that seemed to me even more critical, especially because I posted the COVID hotline and for people to call. Now, one thing I do want to add, which was curious, and others may have heard this as well, many of our unsheltered folks said to me, well, that they actually felt safer outside during the COVID. I've all heard that. I couldn't disagree. But I also, I hope then caution, it was a way to sort of look past all the other risks that are inherent in, of course, living outside as well. So nevertheless, unsheltered folks go into stores, they have chance for exposure, they need masks. They are all part of our community. So it's imperative that they are safe, as we all are.
Yeah.
Yeah,
no, please go ahead.
Oh yeah, I found that, the people that were sleeping in tents, they were doubling, tripling.
Oh.
So on Facebook, I had put it out there about tents, needing more tents, so maybe they could have their own tent instead of sharing. And I got a good response. And then Brian's Angels, they gave out a lot of tents. And also Brian's Angels, they had washing stations made out of buckets with a little faucet and bring it to different encampments, and with the hand sanitizer, soap, and all that.
So what works for me, safety-wise, I've noticed at first it was more like, okay, I would look for, who doesn't have masks, or if I feel like more homeless people wear gloves than people who are not homeless. So, that's something that they take pride in. So I have like the Ziploc bag with 2 masks and 2 sets of gloves, and if I see one of them walking, or, you know, that's how I strike up a conversation. And, you know, I'll see them more than once. And then if they know that I have, you know, masks and gloves, that's how it gets around. Like, well, you know, that's the lady with the masks and the gloves. And I'm like, okay, so that's how, you know, at least what I do is, especially if I'm driving, I try to approach them where they're on the passenger side. So it keeps that space there at least. So I'm not making them uncomfortable and vice versa. Mm-hmm. And I just start off by making sure everyone has at least masks and gloves first.
You know, one of the things I think is so interesting, I think particular to outreach, is sort of our responsibility for education, because people aren't somewhere where there's a TV or a radio and they can hear sort of the updates, and especially as updates were happening. So it's just really interesting to hear people talking about that and you know, playing that role of education, because I think that that's such a critical piece. And I'm, you know, just wondering on that note about hoteling, and, you know, when the hotels were sort of really opening and accepting people, how willing were people you were working with to go into hotels?
Well, we're still operating with hotels. I think we're the only people that are still doing those, and they can't wait to get into the hotel. Like, they're badgering me every day to get into the hotel. But just to piggyback off your education piece, I think that's very important too, because a lot of the people that I deal with, they don't take it serious. They think it's fake. You know, I have to like consistently tell them, like, no, listen, like, this is something really serious and you need to protect yourself. You're out here, you're vulnerable. But like, it's really hard to do that because in their heads, like, they say it's just fake, it's fictional, or it's just this theory, like, no, like, that's not real. So just to piggyback off that, education is truly, truly important.
Right. Yeah, Marianne or David, I was wondering if you had thoughts about people getting into hotels, and do they like that idea versus not like that idea?
They love the idea,
Mm-hmm.
the hotels. Yeah, we just finished September 30th. We were done with the hotels. Mm-hmm. And yeah, no, once the word got out that the hotel rooms were available, it got a little crazy. And there was one time I helped somebody she was pregnant, and she asked if the father of her child can come in, and so they were able to share the room because it's men in one room and women in others, like 2 and 2, but they were able to go in as a couple. And once that went out, there were a lot of newly pregnant women that wanted to be with their baby's father.
Yeah.
So
for myself, those who wish to come inside, I would refer them to the shelter wait list, but the shelter staff managed most of that. When they decompressed the shelter, that's when a lot of folks went into the hotel, but no one directly from outside. We were fortunate too, partnering with the City of New London. We actually had a quarantine center briefly. And that was, actually, I did have one gentleman from outside who went in the quarantine center. He wasn't positively diagnosed, but it was good to have that as well.
So we did just have a question come up in the chat box asking to share like a process in the way they had to adapt. So, you know, I don't know if people have a sense of what they were doing before that's different, as more like, were you going out in twos before and now you're going out individually? You know, I know you spoke about no longer transporting people in personal vehicles and utilizing like public transportation or Uber, which I know we've done as well. Are there any like any ways in which you were working that are a little different now?
Well, I have one. I've been getting more help with like formerly homeless people. They still come around and they offer help. They want to give back and they come with me. So if I don't have anyone to come with me out into the woods to the encampments, they come along.
That's interesting.
Yeah.
Pre-COVID, I was doing outreach with the
I started
hospitals.
February when,
Oh, hold on one sec, Dave. Go
Sorry.
ahead, Sharice.
Pre-COVID, I was actually doing homeless outreach with the local hospital, part of our community care team. So we always went together. But now, since, well, as this moment, I'm still doing it, but I'm doing it alone now.
Mhm.
Couple of months ago, I really wasn't out there, but the hospital was out there for, like, in my behalf and reporting to me about things that were going on.
Okay. David?
again, I started in February just as things were heating up. With the normal precautions, it didn't affect me greatly. But what I'm facing now, actually, New London County is having a spike. So I've got to sort of reorient myself again and really pay more attention to the precautions.
Right. Right. Okay. Well, thank you. So actually that's a really great segue into our next question, which is for those who have started working during the doing outreach, I should say, during the pandemic. How have you established yourself, right? Knowing that a huge part of outreach is kind of getting your name out there, both with the people you may be serving and with the provider network and the community at large. And with COVID, a lot of those engagement opportunities are different now. So I was just wondering if Samm and David could talk a little bit about how you sort of launch yourself as an outreach worker during a pandemic.
The way I launched myself, as you say, honestly, I started with the guests that we have in the shelter, and I let them know I'm no longer a supervisor, I do outreach, because they congregate with everybody that's outside. So with them doing like the initial word of mouth, it became that's her right there, she has whatever you need. So they begin to approach me. So as I approach them, I see new faces, and then, they'll introduce me to other people. I've even had people go like, oh, you're the outreach person they're talking about? I'm like, yes. And then they did there was one statement that was made where a gentleman was like, I would never thought you don't look like one. And I was like, well, what do you mean? He goes, you look regular. I was like, oh, okay. And I feel like the depiction that they have of someone coming to a system is someone with like a briefcase, or like they have dress clothes on. I'm like, no. So I feel like me looking like them, it gives a comfort for them to talk to me. They have no problem with me approaching them. And, we'll start off with small conversations, and I'll let them know, if you need something, just let me know. I'll give them my card, or I'm like, well, this person. So if you need something and you don't have a phone, or they tell you that I'm out somewhere, let them know that, let me know that you're looking for me, and I'll come find you. So a lot of what I've done has become word of mouth, as far as with the homeless individuals, and as far as with different agencies and providers. I'm very big on emails. So I will email 1 million people and let them know who I am and what I'm doing. And I'm very big on calling people back. Because a lot of times you'll call someone, you'll leave a message, you don't hear from them ever or no time soon. I'm very big on dedicating time to call people back, so they get a name and an email, a phone number, and eventually you meet in person or via Zoom, and they can put a face to the name.
For myself, my predecessor introduced me briefly, but I was pretty much on my own. I bring a background of pastoral ministry, so I kind of led with that, a willingness to be present, to be non-judgmental, of course, and simply to take time with people. And being the new person, of course, it gave everyone an opportunity to tell their story again, and I listened. As things have gone forward, though, I try to continue to maintain that sense of presence and just being available and being a regular person, as you say. But I have to admit, and I tell folks outside, I also have a mission, and the mission is to get them housed, and to find ways through perhaps motivational interviewing to say that, living outside is not sustainable, not a solution, is dangerous, and all the things that we know. So on the one hand, I want to be just a very passionate and patient, but on the other hand, I want things to move forward. I've been able, with the support of Homeless Hospitality Center, that I have some resources and I have programs that I can fairly quickly move people into. I'll talk more about that later as well. Now I'm kind of old news now, so the relationship's a little bit deeper and we can have really honest conversations. And particularly now with winter coming, I'm getting a little more, getting more assertive about it's time to come inside, time to get to a place, and we can help make that happen.
You know, Sharice, I was remembering when you first started, and you had gone to one of the drop-in centers, and you came back, and I said, you know, how was it? And you kind of were like, I played cards. I was like, okay, you know. I think outreach has always been that interesting place, right, where, you know, finding commonality with the people that you're trying to serve is always so important. So I didn't know, you know, Marianne and Sharice, if you just wanted to talk a little bit about, you know, just in general, what it takes to sort of establish yourself and to, you know, engage, because that's a process that never really ends.
Right. For me, it's being yourself, being empathetic, you know, and meeting clients where they're at. And I think that's the most important thing, to be on their level and for them to feel comfortable enough to let you in their world, because that's ultimately what you're doing. They're inviting you into their world, what it's like for them at that very moment and that time. And once you establish that relationship, they begin to trust you. So, you know, they think that you're like the #1 person in their life right now. So I think that's very important in engagement, is to meet clients where they're at and no judgment.
Mm-hmm.
Yeah, same thing here. I always wanted them to know that I am there for them, and I'm a friend. I listen to them, and I want them to know that I'm always just a phone call away, message away, anytime. It doesn't matter, you know, 24 hours. Leave me a message, call me, I'm there, and I'll make sure I can help them.
That's about being present.
Just to listen to them, you know, they really appreciate it. Sometimes you aren't able to help them right away, but they just don't forget that you're there for them and you try. Yeah.
Even providing like the smallest little thing, a cup of coffee.
Yeah, anything.
You know, I've had clients that like, I've just bought a cup of coffee and they just appreciated that I treated them like a person, not trying to, you know, get them into treatment, not with a hidden agenda, but just to meet them where they're at, just to treat them as a person, right? You know, and they'll gain that trust with you, and that relationship and rapport with you.
Yep. And the word goes out.
Yeah.
Yeah. No, we say that, right? Like reputation. Your reputation is the most important thing. If somebody, you know, you make 100 appointments with somebody and they cancel on you every time, you still have to be there, because when they show up that one time, and you don't,
right?
You're like, she's never around, or he's never around. Right?
They don't do anything.
Yeah. Oh, you know, just sort of kind of going back to the idea of partners and collaborations with other organizations. You know, I think a homeless outreach worker is only as good as the network that they have and their ability to connect people pretty quickly to the things that they need. So can you talk a little bit about some of the collaborations that you have that are really effective and help facilitate your work?
I can honestly say I wouldn't be able to do what I do without my community care team in Danbury. And on that team, you have everybody from the hospital to providers, mental health, substance, police department, you know, any provider you can think of sits on that team. And that is so crucial. If I can't find somebody, I know somebody on that table has seen them, has dealt with them, can get in contact with them. So that is a major, major source for me, is my community care team.
I would have to agree with that, especially when it comes to like Norwalk Hospital. Like, I'm in constant contact with them. they have a lot of resources to offer me and vice versa. And as opposed to, you know, a client being bounced around, it's like, look, if you can stay put right here for like a day or two, like this can happen. And I feel like now that, you know, I do the work that I do, especially in Norwalk, the clients are more comfortable participating and even suggesting services because they feel like it's actually going to happen now.
Right. Can't open.
Yeah. And the day centers like Agape and Brian's Angels, well, they used to be open during the day, but right now it's grab and go. So they're available for a couple hours for grab and go. But they help me because when they see people when I'm not around, they call me and connect me. And if I'm looking for somebody, I call them and they help me. And also the community services and faith-based organizations help out.
For myself, yes, the community care team has been essential in connecting with a lot of people, as well as the housing placement folks. That's another meeting. I've really made an effort to build that network. Many of the same kind of groups that have already been mentioned, recovery people. I just, a couple months ago, reconnected with the public health people who have a lot of resources. Other outreach workers, the two encampments where I work are very well known. A lot of people are going out there and providing support and services. My concern is it's been a little bit fragmented, and I've been trying to make an effort to pull us together so we're sort of working in the same direction. I too have a wonderful group of outreach, an outreach ministry team, and they know what I'm working toward, and we've really been collaborating. The meal programs are partners. We have a lot of staff at the shelter, so I stay very close to them because our folks are in and out of the shelter. We're a relatively small community compared to some of the cities in the state, so everybody knows everybody, so that sometimes helps. The medical community, recovery folks, mental health people. Recently, I'm working on a project with people from one of the towns and the city council as well. But I think outreach workers have a particular role in organizing and developing those kind of collaborations have been very important.
Yeah.
I work, I'll save that thought for later. Thank you.
Okay.
Oh, I just want to add that we have, in Bristol, we have encampment meeting because we've been having a problem with this certain area got out of control. So we've been having weekly meetings and different people from, you know, somebody from the health department and city community services and different agencies get together and make a plan. Yeah.
It's always interesting when you start working with people that you hadn't worked with before, or thought weren't interested before, or didn't have any commonality, and you start partnering on initiatives, and it can be really exciting, I think, to gain new partners and see success there. Kind of want to pivot now to talking about housing strategies. And, you know, I think, you know, we're in a moment where there seems to be more resources, right, for housing subsidy or rapid exits or, you know, like one time up to permanent vouchers, which I know doesn't always match vacancies, right, in our cities. But I want to talk a little bit about housing strategies that have worked, particularly with people who are unsheltered and, you know, particularly during this moment.
My favorite housing strategy, I would have to say, is rapid exits, because I come across quite a few unsheltered individuals where like they live in their cars, but they go to work. So I'm like, so you have income? They're like, yeah, I just can't find a place. So first thing that always pops in my mind is, listen, we have this program where you just got to find a place. And I make sure I put an excessive amount of emphasis on make sure you can maintain it, because you have to be able to maintain it on your own. And I just feel like rapid exits is one of my #1 go-to housing strategies, because you'd be surprised how many unsheltered individuals actually have income. They just don't, they just need help finding something.
Right.
Because
And
they don't have access to computers and phones all the time. So it's like, okay, I can do the research. We can go look at all of these places and get you behind closed doors.
Right. Right. Even like the security deposit, right? You might be able to pay the rent ongoing,
Exactly.
but just getting the security deposit in, or a utility deposit, or even like maybe that first month's rent, because maybe you're in the hotel, you know, you're in a hotel you're private paying, or you have a storage, or, you know, you've got these costs, but if you were in somewhere, you could get rid of some of those costs and move forward. Any
And
other
Dan,
housing?
yeah, in Danbury, we utilize the rapid exits, the rapid rehousing programs, every security deposit program known to man at this point. But a lot of my clients are long time homelessness out in the streets. So our main sources right now are the subsidies that are going forth. And my strategies for that, like I said before, utilizing your community health, the community care teams, and, you know, security deposit programs, and even landlords. So my strategy is, especially when it comes down to finding units, it's very, very few and far between during this time, which is crazy. But I've learned to develop real close relationships with landlords. Just explaining the program, you'll find that most landlords, they want to help. So, and they admire the work that, you know, that we're trying to do in the community. So that's very important, establishing, you know, landlord relationships, and utilizing the community care team too in that aspect, at least for me, because of the limitation of client contact that I do have. They take clients to see units for me, as long as I arrange it ahead of time, you know, a viewing for them. They'll go out and take them for me. And, you know, that has been the most successful for me, is using all that. Well, your community is very important, you know, those ties and relationships.
At the Homeless Hospitality Center, we're funded by the PATH program. For those who don't know, that means Projects for Assistance in Transition from Homelessness. That's why we call it PATH. And a requirement of that program, of course, is to do an enrollment. And when I started, I dutifully did the enrollments and also did the vulnerability index and so forth. But it dawned on me that actually delays to some extent while we're gathering this necessary data, moving people to housing. So recently, I do those necessary PATH enrollments, and at the same time and at the same meeting, I do the housing enrollment as well. And we have multiple rapid rehousing programs that I can offer folks. So they immediately go on to the housing list. We've also learned that for some who might be eligible for permanent supportive housing, we can bridge with a rapid rehousing program. So again, to shorten any delays as much as possible. Now, there's always other issues that come up. It's never a straight line, but it's nice to be in that position that I can satisfy the requirements of PATH and also do what is our mission to move people into housing as quickly as possible.
You know, I love hearing how many people are accessing like rapid exits and rapid rehousing, because I think there was always this sort of misnomer that unsheltered almost automatically meant people needed a permanent. And, you know, I think the one thing that has I've been reminded of year after year of doing this work, so I've been doing it for 15 years, is that we never know who's really going to be successful in housing. There's no real predictors for us. And I think giving people the opportunity to use rapid exit funds to get themselves into apartments, it's often surprising how many people can succeed in that way. And, you know, and really looking at, you know, like, let's talk about your income. Let's talk about, you know, where your dollars are coming from, because that, you know, rapid rehousing or voucher might be very far down the road. So what can we do today? And I think we've kept this, you know, the safest place you can be right now is in your own home. So how do we get you into that situation as quickly as possible? What, you know, and what do you have to contribute to that? So, you know, I think that's really, really wonderful. We have had a couple of questions come up. So I wanted to save some time to talk about that. The first one is, how is your agency at this moment with COVID approaching situations dealing with youth specifically? So I don't know if people have had a lot of youth unsheltered in their communities.
We partner up with ARC. They have a youth program. So any youth that we come across that's in a homeless situation, you know, we refer them to ARC. ARC, we work together on getting them the services that they need.
Mm-hmm. So like youth navigators, diversion workers. Mm-hmm.
All through ARC, yep.
Yep.
Yeah, I work with the youth navigator at Salvation Army.
Mm-hmm.
We work together.
Actually, you know, a note came up, David. I wonder if you could talk just a little bit about that unsheltered individuals and families are eligible for diversion funds as well. And I know that's something you do.
Yes, and thank you. I should mention that as well. Actually, that's once we have an engagement and we've had a little bit of rapport, that's really where I begin to determine if they have family or friends in other areas, and then we have diversion funding to get them there. Our famous story, we had a gentleman who really needed to get back to Puerto Rico, and we were able to make that happen. So that's where we start. And I find I have to probe a little bit because sometimes folks may have family, but they're estranged. So I might even offer to try to make that call as well. Sometimes we had a gentleman land in our area. He drove here from Florida. He had some family reasons it didn't work out, and we were able to guess back. More often than not, in my experience in our area, though, most folks have connections there. They need to stay, and also they're thinking about not only the initial financial support that we can give them, but how are they going to sustain that, either with disability benefits or income. So, you know, we're always strategizing. But again, we try not to let that be a barrier, and really work hard to, you know, really follow the housing first model, get them housed, and then work with them, provide case management to help them sustain it.
Yeah. Yeah. Do you know, I've always love the reminders that that the housing intervention may not be your own apartment, right? It could be returning to family, staying with friends. Yes, certainly, I think we've all had that experience of like busing someone across the country or flying them or whatever the method, because they have somebody there who will accept them and has sort of guaranteed them housing on that end.
I want to add this because this has been a really helpful strategy. So we may have a family, say, out of town who might be willing to house their family member, but they need a little incentive. So we might say, hey, we can provide support for a couple of months. I think our number is like $300 a month. That can make all the difference. That's diversion money again. And that can persuade an ambivalent family member that this might be a good thing for them to do.
Right. I think especially right now, you know, everybody could use a little bit extra during this moment, and yeah, bringing somebody in can be helpful. So the next question is, are there opportunities for peer outreach? I'm sorry, before I jump into that, anything else anybody wanted to say about youth? Any specific strategies they were working on with youth, or things they had found really helpful?
I don't really come across youth like that, honestly. Like, there's not much youth in this community. And I think if they did, the only place I could really think of would probably be TCC, if they were, you know, willing to go into that program or, you know, receive services from them. But everyone over here is just a lot older.
We've been seeing a couple of more lately, because, and we're thinking it might be because of COVID. we ran across a couple of kids that said they can't live at home because of COVID, you know, because of their lifestyle, and their family doesn't want them to stay there.
I think outreach with youth is often in reach, right? So connecting with community colleges and, you know, high schools and, you know, like youth programs, because there's a lot of couch surfing, there's a lot of, you know, sleeping in cars and, you know, so it's like a little bit different of a strategy and of a connection point. I know just our own experience, like community colleges have been huge referrals for that, because people are coming and maybe don't even identify themselves as being homeless. Like, I'm not homeless, I just am staying in my car while I go to school, and then I stay with a friend, so, but I'm not in a shelter, right? I'm not sleeping on the street, I'm not in a shelter, so therefore they may not recognize themselves as being homeless, and therefore don't know that they qualify for a lot of services. So, you know, it's not so much about convincing them that they're actually homeless, but letting them know, like, even in that situation, however you want to define it, you still qualify, you know, for X, Y, and Z services. So, so the question is, are there opportunities for peer outreach at your organizations, and what does that look like? I'm going to go with no. So I think, you know, you could look at that in two ways. One, in like specific peer positions, and others, is there an emphasis on lived experience with positions at your organization? So I don't know if people want to share like thoughts about that as their organizations. So this may be an area we need to grow in outreach,
Yeah, I'm not
right?
sure I have anything.
Yeah. You know, I can say for Open Doors that we've tried to take a higher emphasis on lived experience in like job descriptions, and making sure that that kind of gives you, you know, maybe if you're not meeting all of the educational or experience levels of social service, but that counts in. But we don't have like specific peer positions. And I think that's something we've been talking about internally and looking at how we can create that. And I think just in my experience, substance use organizations have really led the charge on peer workers, particularly their outreach and engagement staff. And that's something I think that we could all take a look at and sort of model.
I know St. Vincent de Paul, they've been just talking about that, thinking about doing that. Yeah.
So I'm gonna just say to all of those who are attending, we have 10 minutes. If you have questions, please submit them to the Q&A, and I apologize if I did not say that at the beginning, because I think I was supposed to. But the Q&A at the bottom, you can submit questions. We would love to answer them. I thought, you know, maybe we could, sort of last question from me, is, you know, really looking at, we're approaching colder nights, colder days. I think it was 42 degrees when I got in my car this morning. Sort of like your thoughts about this winter, and any strategies you're really thinking about for preparing, and these, I mean, winter's winter, right, for people outside every year. So things that you've done in the winter to help people prepare, any strategies you might have.
I'll tell you a situation we're involved in. The encampment of Horst determined that they want to reclaim that property. It's public property. And they did so for a lot of reasons, but one of the reasons, of course, is anticipating winter. So we're neutral on that. We're a housing organization, but we're using it as an opportunity to talk to people and say, this is the time. Winter's coming. The town is going to reclaim the property. Let's get serious about housing, especially those who have some ambivalence about that. Those who say they prefer to be outside, all the things that, you know, that we hear. So it puts some real incentive there. So that's how I'm approaching it. Again, we're fortunate we have a shelter that can provide a lot of those supplies. This church outreach ministry does a lot of that work as well. So I'm always sort of walking that line between providing basic needs out there, humanitarian support, but not to the extent that it would encourage people to stay. So I always come back to my line about how can we get you housed? What are you looking to do? How are we going to sustain that as well? So that's how I'm approaching the winter. We have supplies if that's necessary. Most of our folks live near shopping centers. Are actually the one site is within walking distance to the shelter, so we were able to provide those supports. We have a warming center that will open up soon.
We're trying in Bristol, we're trying to find a building to rent for the winter months. Because there's no overflow this year in the shelters because of the room. You know.
Danbury, we're really just trying to get people to agree, one, to get assistance for housing, and two, to utilize the capacity of the hotel. Our shelters are not opening this winter at all, so the hotel is all we have. So I'm trying to increase that capacity as well for more individuals to be able to come in there as well.
I think the winter is going to be, that's going to be my rough patch.
It's going to be challenging.
Yeah.
That's going to, because it's now cooler at nighttime, like when it's starting to resurface that I couldn't find in the summer. So now where can I go? And I'm like,
yeah,
I'll find out the answer. Yeah. But like you said, there's no overflow. There's no warming center as of right now. You know, the drop-in center has limited capacity and it's not open as long as it used to be. So that's definitely going to be like my ultimate challenge this season. And I hope that I can collaborate with other agencies and figure out a solution way sooner than later. I'm
so sorry, we had and I know I got to hand it off to David in just a second, but we had one question come up, which was how were homeless people represented in the census? And I didn't know if people had any interventions they had put into place with that, or were relying more on some of the other organizations.
A little bit of information on that. I have to read deeper into it though, and get a better understanding.
So I can say at Open Doors, we did a lot with the census. We actually hosted a lot of events here. We had them come out. We obviously, for the shelter piece, do our part, but had drop-in hours at one of our centers for people to do that. Everyone in the community, not just those experiencing homelessness. And we actually were a training site for their canvassers. So they were people that, you know, others were familiar with, which I think was helpful. All right, I think it's going to be the end. Thanks to all of our panelists who were so great in sharing their experiences. I'm now going to hand it over to David Gonzalez from CCH for our wrap up.
Hi, everyone. Thank you so much. Thank you, Michelle, for moderating, and thank you to each of the participants in the roundtable. I've gotten to know some of you, talking to you about the wonderful homeless outreach work that you're doing, and it's just really uplifting to hear more about it this morning. The question about census is a good segue into our next event. So in just 5 minutes, we're having a keynote address, a focus on Get Out the Vote from Jerry Jones at National Alliance to End Homelessness. So really want to encourage all of you who are serving our neighbors experiencing homelessness to join, get energized and inspired with us about supporting our clients in exercising their right to vote. I dropped a couple of resources in the chat box. The second one was just a link to the 2020 census's information about how they're conducting the census count of people experiencing homelessness, because I know that many of our providers and coordinated access networks have been participating in that effort. And then the other link is just to our website, our webinar series, thinking about one of the questions that came in through the Q&A about further opportunities for providers to share what they're learning and what they're doing. One is that our webinar series on coordinated approaches to outreach, our planned next highlight will spotlight providers who have been modifying and ramping up as some of the CARES Act resources in Connecticut from our Department of Housing start to come online. So watch out for that. Again, thanks to everyone. We have more on the program this afternoon, and join us for our happy hour from 4 o'clock to 5 o'clock, which has been really great opportunity to connect with people from around the country and get a little more FaceTime with the CCH staff. So you will need to leave this session and then click through the link in our virtual program or in the email that went out this morning to join the next session. Thanks again.